Hi everybody, my name is Megan Beers and I am the Director of Programs at Childhaven, and we're here to share a little bit about our work. I am joined today by two wonderful Childhaven staff members, Tracy Kaplan, who is the Program Director for our Flourish program, as well as Janice Davis-Lee, Program Wise Coach at our Auburn location. Welcome, guys.
Thank you. It's good to be here.
All right, so we're gonna just jump right in. As we know, we talk a lot about childhood trauma and adversity here at Childhaven. Tracy, could you start off by just saying a little bit about what that means? What do we mean when we're talking about childhood trauma?
So when we're talking about trauma and adversity, and in particular with the kiddos and families that we work with at Childhaven, we're looking at like our birth to 6-year range of kids. And really it could look like a number of different things. It's in honesty just when a child has experienced some kind of what we would consider significant adversity in their early years of life. So that could be something like there's been neglect at home, there's been some kind of a traumatic event like a loss of an important caregiver in their family. Maybe there's been some kind of medical trauma that's occurred. Individuals that have experienced violence, whether it's community violence, violence due to terrorism, violence within the home setting. Those are just some specific examples, but it really can be a multitude of any factors or even a combination of multiple types of trauma. And then because of those different things that happen to our children and our families, because it's really our families that can also experience these things, we end up seeing different things transpire over the course of our child's lives. And those types of adversity then can really impact how a child lives and grows as they get older and older and as they become an adult.
One of the things that I've found myself saying a lot recently is this idea that I think when people think about childhood trauma, they think usually of one kind of big bad thing that's happened to a child, and often actually the children and families that we're working with, sometimes it is one big bad event, but often it's really kind of like the chronic stress and the chronic adversity that families that we're working with have experienced. Janice, could you say a little bit more about that in terms of the families that we're working with in our WISE program?
I work with the WISE teams, and for those that don't know what the WISE teams are, is that each family is assigned a parent partner, a facilitator, and a clinician. And what the facilitator does is that they bring all the different pieces together. If the child is a part of CPS or any other entities, we bring them all together. And we come up with the plan for the families. And I really like the parent partners, that they are really the advocates for the parents, that whatever the needs are of that parent partner is going to be right there with them. If they need someone to go to court with them, go to the hospital, whatever those needs are, getting housing, whatever they need, that parent partner is right there with them. And the parent partner is actually the significant part of the WISE program. And then with the clinician, the families are receiving therapy, either in their home or they come to the facility. And so even talking about trauma, the WISE team is able to just to help the family through those traumatic experiences, whatever they are, that just strengthens these families, that they are given hope. And I think that's really what the WISE team is doing, is that we're giving these families hope. And I always say that I'm glad that Childhaven has taken on the WISE program for the 0 to 6, because there's nothing in Washington that was taking care of these children, the WISE program for 0 to 6. And I always say that, if we don't take care of our children that are troubled children, they're going to become troubled adults. Troubled children become troubled adults. So I think that what Childhaven is doing is taking our traumatized children so that they then can be healthy adults.
Yeah, I think that's something that's maybe not like that our community doesn't actually talk about a lot, which is what are all the things that happen later, right, when little ones experience a lot of stress in early childhood. And that can be things like physical health concerns and mental health concerns and all kinds of struggles that we don't necessarily link to that early stress.
Add to that, Just like when we think about children and families that are really struggling when it comes to unstable housing, not having enough resources for nourishing foods, not being able to access their family medical appointments even. So going to see your primary care doctor, you're not able to do that for whatever reason, whether it's transportation or just not even knowing where that doctor's going to go and how you even get there during the day because you have so many other stumbling blocks along the way. And it's just those little itty-bitty pieces that can really add up over time and make it so challenging then for the caregiver to even really be able to tackle some of the other things that may be going on in their life as well as the child's life.
Yeah, exactly.
So that WISE component within our Flourish program in particular is really important because just as Janice said so beautifully, we're able to wrap around this family and help them with really finding the stability for the entire family system, whatever it looks like. Yeah. And then we're able to really help that child grow alongside their family and become this productive, healthy, hopeful adult.
Yeah, absolutely, absolutely.
That's a really it's a nice lead in. So I think one thing that's unique about Childhaven, right, is we're not a new organization, right? We've been around for 110 years in the community. and really focusing on the same, like, you know, the same kind of core concern, right, which is young children experiencing a lot of stress. So that's true. But on the other hand, or in addition to that, we're also going through a period of tons of change and shifting really how we're addressing that core problem and how we're approaching the work. So I'm curious, actually, from both of you, how you would describe sort of the transformation that we're going through and how we're shifting, how we're approaching, kind of partnering with families and partnering with community, really, on this healing journey.
Me first or you first?
I know you both have good answers to this question.
Okay. Tag on it. The first thing that comes to mind when you talk about this transformation is really, whatever I say, it comes from love, but it's this idea that we're trying to take a shift in the way that we are really supporting our children by doing even more support to the entire family. Children do not live in isolation. They live amongst their caregivers and they live in communities. And so we really can't just say, I need to have all of my supports directed at the child. We need to be able to have supports that involve the entire community around the child. We're going to get so much more bang for our buck, even though we're not in it for the buck, but so to speak. And that child is really going to be able to be lifted up and moved along swifter and faster through whatever systems we need. And in particular, WISE is a really intensity-driven program where we don't want families to have to linger with us for long. We want them to come in to receive the intense services that they need that support their entire family and life, and then we're like a little lily pad where they pop along the way onto something else now that's really going to give them that next step. You want to take it from there?
Well, I'm excited about the transition we're doing with Childhaven because Childhaven, we offered the day services with our, our teachers and going through that program. But I'm really excited, just like Tracy said, that we now get to support the entire family because the biggest part of most of the children's trauma is what the parents are going through. Getting evicted from home, being homeless, going through drug addiction. So what the WISE team can do is step in and help that parent. A lot of times parents just need parenting skills. They'll say, I don't know how to parent. They're a single mom and they're trying to work and trying to take care of their family. I don't know how to take care of my child. As a WISE team, we find resources. We find programs. We offer activities even here at Childhaven. After activities, once a month we try and get together with even all the family and offer different classes if they need to learn how to budget. And I'm really excited what Childhaven is doing because even the work we're doing in the community right now, they've already heard about the work we're doing in the community. There's one family that the police was called because the dad was in the country, wasn't supposed to be here. And so the WISE team stayed with this family all day. The mom was supposed to have been taken to jail that day. So they had to wait there, have the grandmother come get the kids so the police can come and take the mom. Well, the police came, the social worker came, and they saw the WISE team was there. and they saw the work that we were doing with this family, and they said, because of the work you all are doing with this family, we're not going to take the mom to jail. You all keep on working with her. So that's the kind of work we do with our families, and we're trying to work our way out of a job.
Yep.
You know, we're there helping them and assisting them, but we want to get to a place to where they can say, you know what, I can do it on my own. I can take care of my kids. I got it. I can get them to their appointments. So we're trying to work our way out of a job.
Well, I would even extend on that too. I think it's really important that when we are doing this work, we're also talking about this family perspective, because I think it's that underlying need of really trying to promote the idea of empathy, like empathy for our parents. These, parents, these caregivers, they're doing the best that they can, and too often I think we can feel a little bit sided. We have all of these urges to protect our children, which are so important and so human, but also really thinking about, like, why is this family in this position? What has happened to that caregiver to get them into this place? And building empathy among each other, among our staff, and among our community, so that we can really lean into these families and offer them the support that they need, rather than pushing them away, which doesn't help them, and it definitely doesn't help their kids.
Absolutely.
Yeah, that it makes me think of, I think part of the shift that we're going through is this sort of recognition that this is actually this problem of childhood trauma and adversity is really about all of us, right? One, I think it impacts people that we don't. It impacts all of our communities, right? And then it impacts so many aspects of health and well-being in our community that even if we're not directly affected by ourselves or by someone that we know closely, it really impacts the health of our community. What you're saying, Tracy, leads so beautifully into this idea of so something that we say often, right, around here is that childhood trauma is our biggest problem, right, as a community, because it impacts so many things, and that relational health is the antidote. And listening to you talk really, I think, brings that out. So can you say a little bit more about when we talk about relational health, what that means to you in your work?
Yeah. So relational health really is whoever is connected to you as an individual that is your positive kind of buffer, I guess. So it's a positive relationship, whether it's a 10-minute interaction you have with someone that's incredibly powerful, or a 10-year or a lifelong relationship. And it's something that's going to keep you afloat and help you really just help kind of float you along up and lift you above any of the negativity or the stress that may come your way. Bruce Perry, who you know is one of my nerd crushes, I think everyone at Childhaven knows that, he says that the #1 mitigator of childhood trauma is positive relationships, and that's AKA positive relational health. And then I even think about my next nerd crush, which is the late and great Dr. Barry Brazelton, and he talks about how you don't have to be a therapist to be therapeutic. And it's that idea that anyone in a child's life can be therapeutic to that child because of the positive relationship piece that they're really giving to that relationship.
That's awesome.
It is pretty awesome.
Yeah, it's awesome.
And I think a piece about it, which you brought up earlier, right, is that I think often we think of relational health in terms of our kiddos, right, those in our classrooms or the children that are coming to us for support, but really we have to broaden our thinking there, and we have to think of the relational health of both the adults that we're serving, the important adults in child's life, as well as kind of other caregivers and service providers in the community, because it's only the health of those adults is really fundamentally connected to the health of those kids.
Absolutely. And I think I thought about this one family. We had taken on a family where this child just would not respond to anybody, talking about relational health. So the WISE team had to build trust with this child, started working with the child, and over a few months they opened up, and this family had gotten to the place to where they no longer needed WISE. So we were doing the transitional phase that they were leaving. It was his last day. And he turned to the WISE team and he said, I'm going to miss you guys. You know, it's that relationship that you build trust with this family, especially with the parent partners, how they build that trust to say, hey, wow, you've been through this too? You know, you can relate to what I'm going through. And it makes a huge difference when you're working with somebody who's been there, who's made it through, and to see their success. So that relationship that we're having with our families at Childhaven is amazing, and I love it.
So the last piece I was hoping we could touch on was just so if we say childhood trauma is our biggest problem, relational health is the antidote, and then just this as we go through this organizational transformation, how we Childhaven are innovating to address this problem. And one of the things we know is that this impacts so many kids and so many families in our community that we can't do it alone, right? And we can't do it only kind of on the backs of mental health providers. So can you, maybe Tracy, can you start by speaking just a little bit to our work of like how we think about embedding what we know about relational health, what we know about supporting those of us who've experienced trauma kind of in all the other places where kids live, learn, and play, not just within Childhaven's walls?
Yeah, I mean, I think kind of one of the biggest things we've learned, and we're currently learning even as we grow at Childhaven, is just it's best to go where the children live, learn, and grow, and that might not necessarily be within our own facility. It's definitely more so looking at how things are going within their own homes and within their own specific community environments where they're at. And so being able to take that leap as whether it's a provider or someone else that we can connect with in the community to go out and be with those families, to be those positive relational buffers. That's the big thing. And we are but, one person at a time. And so as an organization, how can we begin to look forward and say, well, where are other places in our community that could be those extensions, where we could really build the capacity of everyone, so everyone understands how they too hold a piece in being a positive relational buffer to childhood trauma and adversity. And I think there are a lot of different ways we're thinking about it right now internally at Childhaven, but we have a lot of different possibilities on the horizon, I think, in particular as we've taken this new leap with our Flourish program.
Yeah, absolutely. Which brought the other thought that each family, they decide who they want to be on their team. And what you're saying about community, they can have a pastor or their neighbor, their teacher. They can bring together whoever they want on their team, and everyone comes together and just work towards the goals for these families to make it successful. So community is a big part of the program, that we bring in different parts of the community.
Yeah, I get excited when I think about all the different, when you think about like all of like the pediatricians in our community, the teachers in our community, the pastors in our community, right? Like all of those folks having kind of the support to understand and really kind of all of us hold that capacity to be therapeutic, right? And so how do we Childhaven be a part of building that in our community? And I think we're really orienting that way. Yeah. That feels like exciting. So I'm curious then to maybe end on like what makes you guys excited to come to work every day?
I want to say that I come to Childhaven because I love the people that I work with, the teachers, the WISE teams, even the administrative staff, and I really admire our, Megan and Tracy, and I just appreciate that you all actually care. Everyone cares about, children. You're approachable, you're available. And I think that's what makes a huge difference here at Childhaven, that everybody literally works from their heart and they really care about the children here. So that's what makes me so excited about coming to work every day. Definitely. I love it. I love this place.
It's an adventure. Yeah. I think that's why I enjoy working at Childhaven, and in particular this time, because we're really transforming ourselves. We're moving forward with everything we've been informed and becoming transformed as an organization and as a community, and that is so exciting. And I think about being able to be a model potentially for other organizations and for people within the community and throughout the state. If that's something we're able to do, that's incredibly exciting, and that would be rewarding, because when we think about that, we're really thinking about expanding the impact of what we can do, and that means more children and more families that are able to really get the supports they need, and that's what excites me. Yay. Helping more people.
Yay.
And you, Megan? Got to turn it right back. You don't get out of this.
No. Yeah, I mean, I resonate with the things that you guys said. I think also it feels like we as an organization right now have the courage to not know. And what I mean by that is we're having the courage to kind of take the latest science, the latest innovation, and adapt and grow and evolve and partner with others to try new things out. We're sort of recognizing that how a community, how we've operated in the past isn't working, isn't achieving kind of what we've wanted to. So I really appreciate that capacity to innovate, and also the value of just relationship every day. I think that makes me smile.
Yeah.
We at Childhaven are taking an all-in approach to addressing childhood trauma, and we are
All in!